could introduce yourselves.
Okay, I'm Dina Mullins, and I'm the social worker here at Goodall Hospital.
I'm Leah Robert, and I'm an MSWI student at UNE. I'm in my last year.
My name is Bill Griffin. I'm a second-year student at University of New England, an intern here at the hospital.
Okay, great. So, Dina, I'm going to start with you. You know, we're talking a lot, and you've heard a lot about the importance of field education. The Council on Social Work Education, our accrediting body, has identified field as a signature pedagogy in social work education, which is very exciting. It's where, you know, the rubber meets the road, where it all comes together. And I'm curious, Dina, you've been a field instructor of ours for a number of years, and can you talk a little bit about why you have made the decision to offer field placements to students?
Because, stop for just a minute. Do I need to look at the camera? I don't.
No, have
okay.
it be
I
a
just want to make sure.
conversation. Yeah, I'm sorry to say
I was
that.
wondering that
Well,
too.
yeah, most
I'm
people
glad you
just
asked.
have it be conversational.
Okay.
It makes it
Sorry.
a little bit easier.
So just cut all this out.
Yeah.
Okay, sorry.
Thanks for
No,
the
I'm
arm
glad.
waving. That helps
Yeah.
me, helps me later.
No, I am glad, yeah.
You know, why you've made the decision to offer
Because I
students
believe that field is a place to be able to learn how to practice in a safe environment with people that have already been there and done that, and it's an opportunity to learn from other professionals and to see how the team effort. And I also believe that as a supervisor, we're gatekeepers to ensure that the ethics of the social work field stay intact and to help people to mature in their own skills.
Great. Anyone want to add anything to that? Or?
I would like to add to the safe place. I agree that this safe place is a place for a student to grow and to maybe not have to feel so secure in their role. That makes sense. You can make mistakes. When you get a job, you're supposed to know everything, how things are done, what you're supposed to do. In field, you can really go to those challenges and take a risk. Yeah.
And you mentioned when the rubber hits the road. I definitely appreciate the field work for that reason, that it's the real experience in the real world. It's not classroom hypothetical discussions. You're there with real people doing real things.
That's kind of a segue into my next question for you, Dean, is can you talk about the role that field plays in student social work education?
Well, first, it allows them to identify skills that they already have and skills that they're learning and theories that they're learning, and they're able to put it into practice, which makes a huge difference because it's like a light bulb going, wow, this is what I studied, now I'm doing it. And it helps them to want to learn more. It helps them to feel comfortable in what they've learned and know how to apply it. Because the big thing is you can have all the skills, education that you want, but unless you learn how to apply it, you're never going to be effective in your trade.
Absolutely, absolutely. Okay, Leah and Bill, can you talk about Dina, your field instructor,
Yeah.
and the role that she has played in helping you enhance your knowledge and your skills?
Yeah. Good. One thing that I've really liked with Dina is that a couple things, but one in particular is that we work a case together. And after we work a case, they say we suit somebody in the ED for a reason. And after we work it, or while we're working it, she's constantly asking questions. What did you see when you were in there? What do you notice as triggers? What do you think the plan of action should be? So we're learning while we're working constantly.
And I appreciate at the beginning we were together almost constantly. I was your tail, and could ask the questions. And well, a couple of things that pertain to this. You, as I gained comfort, were great at letting me go, perhaps prompting me to go out and do something on my own, and also really open to me questioning what I saw and allowing me to try to step back, take a look, and analyze such a situation, and then question it, and get good feedback on it.
Yeah. Yeah, I'd like to add to that because I was going to, just like Bill said, is we can acknowledge with Dina, you know, like the what ifs, or what if I had said that, or could I have done this better? You know, just the questions that you have as you're developing a new skill. I'm sure you may have had the same feeling. You question yourself in a new environment and with a new skill. So to have Dina actually say, you're feeling nervous because this is new to you, but you know what you're doing. You know, to have that encouragement, you can do this.
Mhm.
That was really nice.
Mm.
Yeah.
And clearly, both of you have a wonderful relationship with Dina.
Mhm.
And when you talk about being able to come in and say, I don't know what I'm doing,
Mhm.
you know, I need some help,
Mhm.
really speaks to that sense of safety that you
Mhm.
feel. Do you think that's important? Is students go out looking for a field placement and thinking about, you know, who their field instructor is going to be?
It's very important.
Yeah.
Yeah.
I think
Yeah.
in the interviewing process with me, when I look at students, I look at how eager they're ready to get into the field
Mhm.
and what are their wishes. And I always ask them, what do you want to take with you when you're done with field? And my goal is, with every student I take, is that if I had a job at the very end of their internship, that I'd be able to offer it. So I look at the time that I've invested not as just time, but it's developing that person that I'd want to hire.
Mhm.
And that's always worth every bit of effort that you put into it. And what I find about your students is that they always come prepared.
Mhm.
And they've got a wonderful knowledge base. And they're very eager to put that into practice. And so they're not afraid of new challenges. They may be nervous about new challenges, but they're not afraid of it. And they're willing to ask those questions. So that makes it a lot easier as a supervisor to have that open door policy
Mhm.
of saying that you can work with me and we're going to work together. And then at one point, you know, you begin to break those little cords and say, okay, you can actually do this by yourself. And it's nice to see at the beginning where they're so nervous, and then at the end they're really confident, and it's exciting.
It's exciting. It really
Yeah.
is. Yeah, I would think that's a great reward for you to see
Very
that
much.
process. as a
Because they're going to be my
field
peers. And
Absolutely.
to me, I want to make sure that I'm that gatekeeper for the social work field.
Absolutely, absolutely. I'm curious, Bill and Leah, some challenges, some rewards, thinking about this past year in your field placement. Can you
You
talk
mean
about
examples?
examples? Just thinking about some challenges you encountered here,
Which
Sure.
some of the as well as opportunities. that you had.
Well, I do remember one case in the emergency department. You were out of the building at the time, so I was down there on my own, which I was glad for. It was challenging, and things didn't go as well as I wished they had. It was a woman who had, well, she was having difficulties, and she wasn't acknowledging what appeared to be the situation to the medical staff. And she would not acknowledge something that looked pretty obvious to us. And I could not bring her out of her protective shell, and that bothered me.
Mm.
But it was a learning experience, and Dina helped me to see it that way. And you realize things aren't going to go the way you want them to. And that's part of the learning it's part of the field after your learning process too. So it's learning that part of it also.
And what's exciting is that you'll have another opportunity because you'll be, you know, you'll have another client or another patient
Right.
who will present in a very similar way. So what have you learned from this that you could use the next time? Yeah.
I think to learn to change my expectations, or to realize it's not going to be what I want it to be,
Right.
and that you have to be flexible, and that fortunately for us here and now, this is our opportunity to learn that and hopefully expand upon that. What have I learned? I've learned to try to be more flexible with the clients and look to their needs. Her needs were different at that point than I had gone into the room thinking they were.
Yes.
Mhm.
Yeah, that's meeting the client where they're at.
Yeah.
Yeah, and I notice that for me, with every client that we see, there's lots of opportunity here.
Definitely.
Yes, it's a small rural hospital, but you work with, on every floor, so there's lots of opportunity. We also work with the family center, so there's a lot of opportunity. And with every person that you work with, you have to meet them where they're at. And I know from personal experience that, and it just happened relatively soon, when I didn't meet that patient where the patient was at, and I thought I knew what was best for that patient, things didn't go as well. You know, and you can reflect back on that. You can say, okay, this is what I learned about myself, and this is what I can do differently in the future. Michael said, but yeah.
What about working with other professions? Because certainly this is a
Yeah.
multidisciplinary
Yeah.
setting.
That's been fantastic. I really
Mhm.
enjoy that so much. There's so much opportunity here in this setting.
Yes.
And in my internship last year, which was in a long-term nursing home, nursing facility, here also, for certain occupational therapy, physical therapy, nursing, perhaps dental hygiene, doctors. Did I say nursing?
You just
Yeah,
understand.
yeah.
Yeah.
So, and there are opportunities perhaps daily, generally daily, for discharge meetings or planning meetings, talking specifically about specific patients. I very much appreciate that
Yeah.
part of it. And then again, as an intern, it's known that you're a student, and you're allowed to be inquisitive, which is great.
Yep. And I'm sure Bill has felt this too, is as we grow and we mature and our skills mature, the staff comes to us more. And you become a Dina too. Oh, can you see this patient for me? And that feels really good that you've reached that point.
I think it helps to have an agency that embraces having students, because
Yes.
this is a hospital, but yet it's a learning hospital where people, as we have different students from different disciplines, we begin to definitely change the way things are in the future, because we give them the opportunity to learn. Our staff totally embraces the students, doctors, and, that's a really neat thing to see, is that there isn't a division. When they go to a team meeting, they're the social worker. They're looked at that way, they're respected that way, and that mutual respect definitely grows throughout the time that they're here. And when they're gone, people say, "Now, where's your intern?" So that's nice to know, because they leave a footprint here that says that they've been here.
Sure, absolutely, absolutely. I'm curious, we talk, again, going back to the rubber meeting the road, the importance of the integration of what you've learned in the classroom, in your courses, with what you're doing here. Do you find that you can use what you're using, our mission statement, which we really emphasize in our coursework and in our practice, are you able to integrate that in your field placement?
Yeah, definitely so. A big part of it is seeing the individual for the value of a person as a holistic approach. We have the definition of health. I may not be able to rattle it off word for word, but
If you need it.
but it includes the holistic. It's
Yeah.
not just the absence of disease, but health, physical, emotional, social, spiritual, those types of elements that come together as a whole, a person as a whole. And the empowerment, looking at the individual and really wanting to find what their needs are, which I had a hard time with in that example I brought up a few minutes ago, the woman in the emergency department. But it did come back to me afterwards, realizing, all right, I need to be looking for that individual, what their needs are, what their wishes are. And very much my frame of reference is that while I'm here. Yeah.
Yeah, I'd like to add to that too. One thing that I was working on a paper actually this weekend, and I was thinking about it, I had to reflect on my practice here. And what I find has been a learning curve for me too is when you go into a patient's room, you have to find out what role you're playing. And then from there you can pull from your bags of tools that you've gotten from school. For example, I had a patient who was upset with the nurse. So the role of the social worker at that point was to hear both sides and kind of mediate the situation and find a way that they can either A, work together, or B, do we need to find another nurse to care for this person. So I think that's helpful. Once you can identify what your role is, then you can bring in tools such as empowering tools. We worked with a victim down at the ED who was a victim of sexual assault and domestic violence. We really empowering her to make choices on her care, how she wanted the kit to be done, was the role that we played in that for her. So I think understanding that role and then bringing in what you can from school is great. And also, when we talk about hitting the pavement, yeah. You do this here, don't you? Don't you feel like when she gave that metaphor that's us? When we come in,
definitely.
we just go to work and we do that. But we also do take the time to go over with Dina, hey, we're talking about this philosophy. what are your thoughts on that? And again, that's what Dina will ask us when we leave a room. What did you notice?
And I think
What tools worked?
I think the assignments
Yeah.
that you guys got this semester also helped you to look at things differently because those assignments corresponded a lot
Mhm.
with what you're doing. You were able to take examples from here
Mm-hmm.
and put them into your coursework and go, oh yeah, that's it.
Mm-hmm.
And also advocacy.
Yes.
Yeah.
Yeah, definitely going to bat for the individuals
Mhm.
who are in dire straits,
Mm-hmm.
you know, financially. Homelessness
Yep.
has been an issue we've seen here.
Yep.
Um, State guardianship for some people who need that support and helping them to get that support. And what was the other example? Just the guardianship. Sorry, I lost it. I had another example.
Conservatorship.
It's gone. Sorry.
And then, but then,
Strike that one.
yeah, no, in addition to that though, Bill, we really, really are trained to understand a person in their environment. And that when they come into the hospital, they bring that environment with them.
Mm-hmm.
And that's a lot of what our school has taught us when we're getting our classes, and you see that here. So sometimes we have to educate professionals here as well.
Mm-hmm.
Yes, I know you're dealing with the physical portion of it, but here's the social, emotional side of it, and they all go together, like Bill said, the holistic piece.
And I
Yeah,
do see.
so
like,
you have to advocate for the patient too, our
Every-
professionals.
Yeah.
Yeah.
And it's a difficult challenge seeing the national picture. We're in a time now where the healthcare coverage is being debated in Washington. And we have to wait to see what comes of it. But seeing a small hospital advocating for people at the street level,
Mhm.
yet realizing that there are limits to what they can do, financial limits, and where's the balance? So we talk a lot at school about that and advocating for people. But we see the reality here
Mhm.
that there, unfortunately, there are only a certain amount of dollars, and we try to help bring the two together.
Yeah,
Mhm.
with examples just for, yeah, exactly.
Yeah.
Exactly.
And as in the real world where
The
we
real
are,
world.
it's very difficult.
Yeah.
So you're really talking about some social justice issues,
Yeah.
and
Yeah.
I know the school
Yeah.
really places a lot of emphasis on social justice, and I'm wondering if your awareness, looking around you, if your awareness of social injustices has increased or changed in some ways since you started in the program.
Oh, definitely since we started the program, yes. Yeah. I mean, just thinking of, I'm just trying to think off the top of my head, but we just recently had a person in the ED a young woman who passed away due to self-medicating to control a health issue that she couldn't get health insurance to cover, and she didn't have money to cover. So buying pills on the street to help her health issue because she can't get a basic need met. And the result is death. So, yeah. I don't know about
Yeah.
you, but I mean, that's just one example of my
Yeah.
eyes being like, whoa, you know.
Yeah, and I see examples, and I just wish there were answers. I know there aren't, but awareness hopefully is the start. In school, we talk about social determinants of health, and I have seen people and gotten to know people who fit that profile, meaning that if someone's, say, in their 40s or 50 years old, and they've lived for their entire adult life, a very stressful life due to their financial situation, perhaps their cultural status within the larger local culture, they don't fit in, it's a stress, as much as you wish it wasn't.
Right.
And you do see the repercussions over time. One individual I'm thinking of, diabetes, intestinal difficulties, I think, are long-term ailments as a result of a stressful
Mhm.
life because of his life situation.
Mhm.
And that's the type of thing we look at school a lot, and
Mhm.
I now see it in a light that I definitely did not prior to my studies here
I
at
second
UNC.
that, that's right, yeah,
You know, I'm sure you've heard, because we say to students coming into the program, and I'm sure, Dina, you heard that, I heard that, that you're going to leave a very different person than the person that you were when you entered the program. And I'm wondering, as you're now leaving and graduating shortly,
Mhm.
do you see yourselves as being in a very different place?
yeah. Mm-hmm.
Mm-hmm.
Yeah. I mean, just thinking of, I'm just trying to think off the top of my head, but we just recently had a person in the ED who young woman who passed away due to self-medicating to control a health issue that she couldn't get health insurance to cover, and she didn't have money to cover. So
Yes, very much so.
You know, as a field instructor, it's amazing to see their growth, and it's amazing to know that when you write that letter of recommendation for their job and for their licensure, that you are part of that. To see, because what I see is their confidence building. They may come with a certain skill base, but every time they have a case, it gives them a little bit more assurance that, okay, I can do this. And so even if the next case is different, they're able to apply it and feel really good about themselves. And so it's really neat for me to see, to be able to see that and know that I was a part of that.
That's great.
I would hire both of them.
Wonderful.
Oh, and I can see definitely, there are roles that I see as I enter the job market, jobs that I wish I could just get, and I can just see myself walking right into and acknowledging there's going to be a learning curve to learn that position. That prior to this, no way. I wouldn't have had the knowledge base. Do you want a specific example, or?
No, I
No.
was
Okay.
any insight that you might have
Yeah.
as you think about this whole
Yeah.
process.
I guess it's given me the awareness that I can look at a system and try to get an overview of how it operates and how I can fit in there and help it to operate.
Mhm.
Whereas before, I would have been one cog in the wheel, is that the right expression?
Mhm.
Whereas now I feel like I have the ability to stand back, take an overview, try to really assess the situation, and then hopefully get myself in a position where I can jump in and start working.
So I think what I'm hearing you say is that your field placements and your classes have really helped you prepare you for the profession of social work.
Exactly, yes.
And I really can't imagine doing it without field placement.
Oh, yeah.
It wouldn't be valid. I don't think.
Why?
It would just be hypothetical.
Right.
You'd be in a classroom talking about it
Yeah,
instead of here you're doing it.
exactly. Yeah, it's one thing to hear about injustice, read books and Audre Lorde and The Working Poor that we read, but it's another thing to sit next to a person who is working poor, who can't get counseling because there isn't a program in town unless you're homeless, or if you have main care. But I'm the bus driver at the high school in town, but nobody here can help me because I don't have insurance. So it's one thing to actually meet with a person and see them and be with them in that spot than it is to read about it. You read about it and you get the gist, and you meet with them and you get an understanding. Yeah, absolutely.
I'm curious, how would you evaluate, talking about the field education program at UNE?
Okay.
We have 3 field faculty, and we spend a lot of time with you doing field planning. We really talk about the fit, and I'm wondering if that's been a helpful process, not helpful. How would you?
I think it is helpful process, and I don't know if it was Amy who told me, or a fellow student had gone through the program, but when you meet with your field instructor to be really kind of interview them too. I know when I met with Dina, I had some questions for her. This is my challenge. My challenge was having the direct conversations with clients. Is it something you can help me with? And finding out what they feel. And if Dina had said, that really I don't think that is something I could help you with, I would have been here today. But and noticing in life when you work with people, your personalities, you have to make sure you get along. And this is your learning experience, so make sure that you pick a placement that's going to offer you a lot of opportunities and that you're not necessarily going to be comfortable at, but you already know how to do it. Because this is your chance to go out there and learn. Yeah.
And I really think the key thing is being flexible.
Yes.
That's probably one of the questions that I ask every student to come in. Are you flexible? Because the real world is totally different. And you never know how policy is going to change the way you do business. You never know what the social factors are that's going to bring someone into this facility and how that's going to do a dynamic. And you never know if you're going to get paged when you have to go to a meeting. So not allowing those little things to get to you so that you can be flexible and knowing that in that you can still meet the needs of everybody. So I think that's probably my biggest word that I ask about that is flexibility.
Flexible.
Uh-huh.
And you're flexible in
And
turn.
as a
Yeah.
supervisor, you need to know what are some of the things that your intern needs to have. Because if I had a student that came in and said, well, you know, I'm one of those people that I like to do this at 9, I like to do this at 10, and I would know immediately that this would not be a good fit. Not that they wouldn't be a good social worker, but it wouldn't be a good fit because our agency wouldn't meet their type of need.
Mhm.
And so, just as well as them knowing us, we have to know what our facility can offer them as a student and make sure they have an understanding of that before they walk in. Because it wouldn't be fair to them if they walked into an agency expecting something and realizing, wow, I'm not getting that. You know,
Absolutely.
in this field, there's a lot of hands-on. And that's something I'm very upfront also about, is that you're gonna be doing hands-on work. It's not about reading manuals or policies. It's not about all of that behind there. Yes, you need to know them, but how do you apply them? And then doing the hands-on, a lot of hands-on in this type of environment.
Mhm.
And the faculty is definitely very helpful from the very beginning. There's a large notebook of
Yes.
agencies where the school has relationships with, and we can decide what we want to go for. And then once we're started, we have a weekly or bi-weekly, depending on the which format you're under, as far as classroom meeting, seminar class, where we discuss what we do here.
Mhm.
So we can share with our fellow students, and the professor is the facilitator of that seminar class. And I appreciate what they bring, the experience
The
in the
fellow
field.
students and the
No,
professors.
well, I was thinking right now, the professors.
Yes.
Yeah, because they have the perspective of having worked in the
They
field.
do, I know, it's nice.
So they can, maybe help you see something in a different light, let you know what you're going through is okay, it's normal, or if it's not.
Mhm.
Perhaps drawing on their own experience, bringing out an example of a similar situation they've been in. So all those kind of things are very helpful. And I really enjoy those classes, because it is a time to go back and forth with your fellow classmates and hear what they're doing in the field.
And you
And-
learn a lot about what they're doing in field, like something you want to do
Definitely.
next year for placement, or they come across something and you're like, ooh, that's a good idea, I'll do that next time I'm in that situation.
Yeah.
You know, if they have a plan of action
Yeah.
that worked for them.
And actually, no, I was just talking to someone recently, I hadn't really thought of it, at least not recently, but it can be, as future practitioners, it's a great networking source.
Mhm.
People you meet in school, well, you never know who will stay local to our area, but even if you're not, I suppose, it's easy to communicate, and stay in touch as time goes on.
And even online, there was a gentleman in our online class from Canada, and we were able to hear about different policies over there versus over here, which
Yeah.
was a nice conversation to have.
Yeah.
Great.
Yeah.
Good. Good. In closing, Dina, you've been working with our students now for a number of years, and I'm curious what you think of our program, what you think of our students. Are they well prepared?
Yeah, one of the things, I really do think, I think every student that I've gotten from your school has been very prepared. And I think that they're already at that master level, which is really nice to see, because it's about tweaking and not teaching completely everything, because they have a skill base that they come in with, and that's really nice to see. They're enthusiastic. They definitely add a lot to the organization when they come in. I think that you have an open policy, so if we had any problems, we could call you. But I definitely think that students are top-notch that have come through your program, and it's been a really big delight for me to have them come in.
Great.
So,
Good, that's good to hear.
Yeah.
We'll keep sending
Yeah.
top-notch students. Anything else you want to add, as we talk about the importance of field education, your experiences as a field instructor and students? Anything else that would be helpful for us to know?
As far as supervisory, for me, I think that as you supervise students, you have to find what works for you as supervision. Because like in this setting, sitting down once a week for 1 hour didn't work. Because the paces here are so much faster that if I were to say, well, you know what, next week we'll talk about that case, that I may not ever get to that case. So by doing it right after cases, it's allowed them to learn, it's allowed them to use their critical thinking skills, and allow them to see how they would perceive it and if they would do anything different. and giving them the opportunity to say, you know what, I would do this different because this is the way I approach things.
Mhm.
So I think it doesn't just, it's not the students that just get educated while they're here. I think we as field supervisors get educated also. So, and they come in with new information that we may not have heard. And what's really nice is that they're a breath of fresh eyes, because when they see a social injustice that may have become a norm, they pick it out.
Mhm.
So that's really good.
Yeah, it's wonderful, wonderful to hear.
Yeah.
I'd like to emphasize, we did talk about it a little bit earlier, for someone to try to find a new and different experience in their field work. I've stayed within, in my 2 years, I've stayed within the medical setting. Being here at a rural hospital is so different from a nursing home,
Mm-hmm.
and I've enjoyed that very much. So I would just recommend for anyone looking at the choices when they go to try to determine where they'll be in their field work, look for something to stretch yourself, a little
Mhm.
different.
Yeah.
Yeah, I agree.
You don't want to stay in your same comfort zone.
Definitely.
Yeah.
Yeah.
Well, thank you very much.
Thank you.
Appreciate all the
You're welcome.
the feedback,
Mm-hmm.
information. Okay. Does Dina have to introduce herself again? This will be in another mod. You ready? Go.
I gotta do this one. Then. In five,
Now you're gonna make us
4.
loud. A little bored. Okay.
You messed her up! Not.
I'm really not.
Dean, I was wondering if you could talk a little bit about the role of the field instructor for students as they go through their field placement. What do you see are some important pieces to your role as a field instructor?
I think is to empower them. As I look at students when they come in, I want to empower them with being able to use their skill set, and then to empower them with the challenges of what we face every day.
Mm-hmm.
And as they do that, I see personal growth not only in their personal life, but also in their professional life. And I think that when we educate and help educate students, it's applying what they know, understanding the theories, and how do you apply it to everyday life. And then looking at students as peers. As you begin to accept them, as you begin to work with them, you have to realize that they're going to be your peers. So whatever you invest in them, you're investing into the field of social work.
Okay. What about in terms of you talk about sort of encouraging them to stretch, to
I like to take I personally like to take students to what I call the uncomfort zone. Is first of all letting them know that if they ever get in a situation that they really feel that they can't handle, that they have the right to come tell me.
Mm-hmm.
Because I don't want them in a situation that they absolutely feel they can't handle. But I also want them to feel uncomfortable, because it's in that uncomfort zone that they learn the most, and they learn how to apply what they know. So as they're doing it, you get them, you push them, you teach them, and it's kind of like that eagle bird that kind of pushes them out the nest and go, okay, let's fly. And you put them in a situation where at the beginning, maybe it's a little thing that makes them uncomfortable, and they get used to it, and then you get them to another big thing, and then allowing each moment to take its own.
As you know, our online students will be finding their own field placements, and they'll be interviewing with field instructors. And I'm wondering, what are some things for them to be thinking about as they go out on that interview? We talk about the fit.
The biggest thing is to know what you want. What do you want to get out of an internship? And so what type of personality would you work with? Because if you're in an internship that at first you don't feel comfortable and you just accept it, then it's not going to benefit either you or the organization. You need to know exactly what you want and be willing to stretch out of something that you maybe not be comfortable with, but something that you have interest in. What would you like to do in the future? Because a lot of times when they're working like in the hospital setting, they might find a whole population that they never thought they were comfortable with, and then all of a sudden be comfortable. So it's about willing to stretch yourself. It's about willing to go find the place that you need to meet your needs, and looking at how is that agency receptive to students, because that really does play a role. Are the students something that's being embraced, or is it not? And if it is, then I think it's a great opportunity for students to have an opportunity to learn and to be empowered.
Okay. So what are you looking for when we've sent a number of students out to you for interviews? What are some things that you're looking, when you interview this potential student or potential field placement student, what are some things that you're looking for?
One of the first things I notice is how they carry themselves when they come in. You know, I know they're going to be nervous, but are they confident? Do they feel as though they're going to a professional interview? Because I think they have to take the role of that interview process serious, and they have to look at it as an opportunity.
Mm-hmm.
And then it's a matter of, okay, where are they skill-based? What do they want? I really want to find out what they need, and what are they looking for, because I want to get the information from them, and so they need to have that type of information in their mind anyway. And the things that I ask students are, what are your strengths? Tell me as a social worker where you're at right now, what are your strengths? And then tell me your weaknesses.
Mm-hmm.
What are the things that you feel that you need to fine tune? What are the things that you need to, that you're not comfortable with at all? Because sometimes knowing that information can help you walk them through an uncomfort zone, even though it's uncomfortable.
Mm-hmm.
And also about flexibility. For me, in this setting, you have to be flexible. We are not an agency that has everything happening at 10, 11, or 12. We are definitely by the moment of what's happening, and we are patient focused.
Mm-hmm.
So most students here, they may know about the policies, and they may know where they're at, and the big ones they learn through orientation. However, they do a lot of hands-on here at this facility. And so what is their comfort about being in front of a patient where you go to the patient and them not coming to you?
Mm-hmm. Do you ask for a resume?
Yes.
And how do you look at that resume?
I look at their experience, I look at things that they've done, not so much experience in the social work field, but how have they connected with people in the past? What type of roles did they play? Did they have any community involvement? What did they do for interest things? And what type of education do they have? Because some people that are at the master level may not have had the bachelor level of social work. So what got them to the field? And that may be one of the questions that I ask. If you switched fields and now you're getting your master's in social work, what is it that made that transition for you?
Mm-hmm.
And then the other two things that I always ask students, what is the difference between enabling and empowering? Because I want to make sure that they have a great knowledge of that. Because it's very important that they come in and to realize that we are really here to empower patients and not to enable them. And sometimes if we try to do too much, we're enabling them and allowing them to stay stuck in a system because we haven't given them the knowledge of how to get out of that system.
Great. So you've accepted the student, and kind of going back to your role in their educational experience. We see you we identify you as adjunct faculty. We see you as the student's educator in the field, as mentors. Do you see yourself that way? Do you see yourself as more than that?
I see myself as a gatekeeper. First of all, I think that I owe it to the field of social work to be a supervisor, because this is my way of paying back to a field that I absolutely love. And I'm passionate about what I do. And so I think that I'm hopefully empowering students to become the best that they can be as a social worker, and that they can find in themselves the type of social worker they want to be. What I also like is that I get to look at them and see what type of skill sets they have improved on and who they become. But I do think I'm a mentor, and I hope I am. I'm hoping that when students leave here, that they leave here with a sense of confidence, that they leave here with the ability of knowing that they can do the job that they want to do, and that they would be hired upon discharge, because that's upon leaving the facility as a student. But it's really a nice thing. I think that your staff is always supportive, and I know that they have an open door policy so that I can call them if I need them. That's nice to know, and sometimes having that knowledge doesn't mean you always use that knowledge. And so and then when we do the contracts, when we do the interviews in the middle of see where someone is, not the interview, do you know?
The evaluation.
Evaluation,
Yep.
thank you. When you do the evaluation, you really get to see what are their skill sets and how do they meet their goals, and do we need to change them? Because sometimes in a flexible setting, you have to rewrite the goals because they changed due to whatever. So being flexible yourself. And one of the things that I look at is also with students is that I realize that students are students, they're parents, and that this job, this internship, is a setting that they're not getting paid for, but they're not by financial means. But I'm also very flexible with their schedule, so that if there's something that they need to do and want to do, that I'm okay with that, because I want to encourage them to get as much as they can from the learning experience at the college, if the university is offering things that they can be a part of. I definitely want them, because I think the whole experience of being involved in organizations at the school, being able to bring their families into the environment of where they are at and meeting those needs also helps to make them better students.
Great, great. You know, I'm just thinking as I'm listening to you, we tell our students that studies have shown that 10 years after graduation from MSW school, if you asked graduates to talk about their instructors, their classroom instructors, and who they are, they won't remember them. But if you ask them to talk about their field instructors, they have very vivid memories. And it really speaks to the important role that you play in their education.
Yeah, I was actually on my email today, and I had a student that I had quite a few years ago that just emailed me for a job reference. So, and it's really neat because she found me here in Maine, and where I was from Texas.
That's great.
So,
that is great.
yeah, and I think the networking really does make a difference, you know, because they become your peer. And if they're stay in the area, you see them, and they're that peer, and they're that person that you respect. And it's, to me, I love that transition. I love the transition when you see them come in as a student, and they're really eager to learn, and they are right there with you for a long period of time, and then all of a sudden their skill base begins to really flourish, and then you see them a little bit on their own, and then eventually they're able to do that caseload, and they're able to do it with confidence, and then they graduate. And that's kind of a mixed emotion with me when they graduate. So, but I'm very excited about the fact that I've been able to help them through that transition, because I know how important field was for me. I really learned so much from my field, and it defined who I was as a social worker.
That's great. That's great. Anything else that you want to add?
I think the students that come from UNE have a very strong education base, and they have a good theory practice. The fact that you guys do things at the school, that you do a simulation activity that helps them to learn the interdisciplinary plan, to learn where they can grow, and having their peers look at them so that they can get feedback from their peers, and that you offer also education beyond their school, that when people get back together for the supervision conferences and being able to go back to your school, it's really nice to do that networking and to realize that you also offer education to us out here in the public.
Great. Well, we try.
Yeah,
We
you
try.
do.
And we'll be doing that for the online program too. Good. Thank you.
You're
Thank
welcome.
you, Dina.
Okay, now I'm ready.
Okay.
Thanks.
Oh, thank you.
I know, 50-50.
Leah and Bill, as you know, the students in the online program are going to be looking for their own field placement and going on interviewing with agencies. And I'm wondering if you have any suggestions for them based on your own field planning experiences, any ideas that might be helpful for them as they think about the type of agency they want to be in, as they think about interview questions for the agency representative, for the field instructor. Any thoughts?
One thought I had off the top of my head is to make sure you interview at probably at least 3 places. And I would recommend doing something that you think you might never like to do. I was just in class with a student who told me that she did not think that she would like to work with elders, that generation, that population, excuse me. And so she took a job at hospice, and she's working with an elder generation, and she loves it. And now her roommate is a woman who's older, that she lives with. She said, I can't get enough of them. I love it. So I think we all go into our MSW with a plan in our head. This is what I want to be when I graduate. And don't be surprised if that's not the plan that you follow. And I think you can learn a lot about yourself if you choose a field that is challenging. And one that might offer both the ability to practice micro and macro work. I found that my first year in field, in my second year in field here at the hospital, I had the opportunity to do that, and it's nice because I didn't think I would like macro work, and I actually do, like reaching out into the community.
I would say find an agency, well, several things. First, look for a supervisor who is willing to spend time with you to do the supervisory, the
Yeah.
educational component, and to find an agency that has work for you. There's some people that might be looking for interns that may not really have enough work to keep your interests going, so that's important too. I was thinking, what you already said, try to stretch your horizons, find something that's different for you. That's it.
I'm trying to think of questions to ask at the interview. I know you had mentioned that, and I did have some questions when I went to mine. I think an important question to ask is what practice theory do you as a supervisor practice from? It would be one that I would recommend asking.
And in that light, ask
Yeah.
what your role would be with the clients, the population
Yeah.
you're working with, what the expectation is. It would be nice to hear that from the potential supervisor,
Yeah, and
along
have-
the same lines that you're
yes.
saying.
And have a clear understanding of what your day is going to look like. And I think what I'm thinking of is when we do meet in field with our field advisor, the professors, I have had experience with students thinking that their field placement is going to look like ABC, and it doesn't. It looks like XYZ. So making sure that you have a clear understanding of what your day is going to entail and what your job is and what the goals are for you. Would you agree with that, Bill?
Yeah, although keep in mind, a lot of positions, a lot of fields, the day will constantly change. So it might
Yes.
start out, you might think it's going to be one thing, and it'll turn out to be the exact
Yes.
opposite. But I think what you're asking is, what's the format? What's
Well,
the
also, I've had someone go in
environment?
thinking that they were going to be more of a clinical social worker, and they end up being in a case management position. So those are two very different roles that you're playing. So make sure that you understand the role.
So not to assume that whoever you're interviewing is going to tell you that you need to be asking that, so you have a pretty clear idea of sort of the expectations of a
Yes.
student in this agency.
Yeah.
And how would you fit in with the other staff
Oh.
at the agency? And what is your role there, and how do they see the intern's role?
So speaking of that, how do you see the intern's role as being different than that of an employee?
Oh, so different. To be honest with you, it's nice to not have the responsibility that an employee has. It allows you that flexibility to experiment. We talk about it being a safe environment for learning. You're stretching yourself, you might make some mistakes. That's how you learn. An employee wouldn't have that flexibility, or not as much flexibility. So that's a big one right there.
Yeah, I agree.
Yeah.
Yeah. Trying to,
Oh.
it's nice not to have the responsibility, like Bill said, of you have to be there 8 to 5, Monday through Friday. You can have some flexibility that way. But it is nice to have that safe environment to grow. and
Another
to
thing I
learn.
really
Yeah.
enjoy is I have as an intern, you can spend more time on a case or
Yes.
with an individual client than you probably would as an employee.
That's a really good
Yeah.
point, because you don't have, here I have had the same experience where I can sit and really listen and not feel like I need to rush the
Yeah.
patient
Yeah.
on an issue, because I don't necessarily have to be at that meeting at 9 o'clock.
Exactly.
Yeah.
Yeah.
And it really speaks to your caseload or your, workload as being different than that of an employee. And that we really look at the quality of the experiences rather than the quantity of cases that you have, so that you can do that very thing, to spend some quality time
Yes. Yeah.
looking at that case.
Definitely.
Another thing is seeing yourself as an expert. As an employee, there's a level of expectation that you're going to know what you're doing. But as a student, I think you said that it's an opportunity to learn, so not to
Exactly.
expect that you'll be the expert.
Right.
Yeah.
And as Bill was saying earlier when we were talking, you can go to those meetings with other professionals and ask questions, because you're not quite certain what their role is, and that's okay. You can inquire and ask
Yes.
those important questions.
Yeah. Which is great. Gives you license to ask questions.
Mhm.
Yeah.
It's just really wonderful.
And to go into your field instructor and say, I don't know what I'm doing.
Right.
I really blew
Help
it.
me.
I blew it.
Yes,
Right, and
yes.
expect that you won't be somehow
Oh, yes.
chastised or.
Exactly. Yeah, going to field instructor and said, I just said this way to a patient, and I'd like to reword it. I don't know how. Yeah.
Exactly.
Yeah.
What are some tips in terms of, as you, because you interviewed for each placement several different sites, and Lee, you just said it's important to, and we encourage students to interview at more than one site.
Mhm.
What are some important, what are some tips in terms of how do you determine which is a better fit for you? What should students be looking at or looking for?
Sometimes it's hard in a first meeting, but do you feel like you're a match with the individual who would be your supervisor?
Mhm.
In other words, can you envision spending a fair amount of time with that person?
Mm-hmm.
It's interesting being here at the hospital. Dina's schedule is, there's no schedule.
Mm-hmm.
It's really hectic because she's on call in the whole hospital. Yet, she makes it comfortable to be here. I don't know how, but she does. Which, to be honest with you, might make it a little challenging interviewing. But looking to see if you feel that the supervisor is someone that will make a commitment to you. I think that's what it comes down to.
Mm-hmm.
Because you want someone who's in it for the educational aspect of
Mhm.
it. So incorporate that into your interview. When you are being interviewed, you want to interview the prospective supervisor also. As to
Mhm.
will they put the time in for you as a student?
In addition to that, I'm just thinking back from when I had my interviews. I think knowing what you want to get out of a position is important. For me, I like diversity,
Mhm.
and both my field placements offered that. And other places where I interviewed, I would be doing one role, and that would have been going into the home and working with families, which would offer diversity, but not what I have here at the hospital, where I'm working on every floor with different patients. And also, an important thing, and I don't know if Bill mentioned this or not, is really, again, stretching out of that comfort zone.
Mhm.
Because this is your time to do it. You're allowed not to know everything about macro work or micro work. So really allowing yourself to stretch out of that comfort zone and acknowledging that in supervision with your supervisor, I know I haven't made the phone calls you told me to because I'm nervous, or that type of thing. And I need more help from you on how to approach it.
Mhm.
But when you do move out of that comfort zone and become comfortable, it's very rewarding. Yeah.
Absolutely. Yeah. Any tips on how to prepare for the interview? What to do prior to the interview?
You should have questions ready, and you should practice them. You should have knowledge of the agency that you're going to see, and you should dress like you're going to a professional interview.
And then I would say be yourself.
And be yourself.
Don't try to
Yes.
fake it and pretend you're someone you're not.
Yes.
And don't pretend you have all the answers because you wouldn't be going there in the first place.
And one thing my father told me when I was young, interviewing for jobs, if you don't get the job, it might not be because of who you are. It might be that the supervisor knows someone in the agency who's not going to get along with you.
Mhm.
And it's not going to be a nice mix. Or for some reason, it's not going to work out. But try not to take that personally.
Absolutely.
Yeah.
Yeah. And I think another thing is to trust your gut.
Instinct.
We talk
Yes.
about that.
Yeah.
Yes.
Because we talk about the fit.
Yes.
And maybe you could say a little
Yeah.
bit about that.
Yeah.
If-
It's hard to describe a gut feeling, but
Mhm.
you do have that. You might have red flags coming up if something's just not quite right.
Yes, and listen to those. Yeah.
So you have to listen to those and analyze those.
Mhm.
How do you do that? I mean, that's kind of a difficult thing to
Yeah.
really describe.
But I think when you go to your 3 interviews, you'll get a gut feeling onto which one. At least I did. I did for both years. I got a feeling this is the one.
Mhm.
And you can ask fellow students who've been there.
Mhm. Mhm.
What did you think of your internship there? What were the pros and what were the cons? And
Mhm.
see if that helps you get an answer.
Or ask at the agency, is there a student here currently, and is it
Yeah.
okay if I
Mhm.
interview, or if I talk to that student to
Mhm.
get a sense? I know we encourage that.
Yeah,
with
I
our
think that's
students.
great.
I think another thing is using your field advisor, because all the online students will have, a field advisor who will
that's
be helping
great.
with planning. So,
Oh.
using your
Okay.
field advisor to talk about that feeling of
I have to
something's not
say,
right.
that's what I did with Amy.
Did you?
Yeah,
Mhm.
yeah.
Can you talk a little bit about that, if you remember?
I just had said to her, you know, it was my first year. I had 3 different interviews, and I remember sitting down with her because it was difficult to choose. They both offered, all 3 offered something, so we would sit down together and go over what they all offered,
Mhm.
and really narrowing it down to my first choice and why that
Mhm.
was my first choice and why that placement offered the best, I don't know, qualities for that year.
Mhm.
Yeah, and honestly, I the first year what it came down to is one placement. She and I both agreed was more of a second-year student
Mhm.
role, and that I would be missing out on some key skills that I needed to gain in my first-year placement.
Mhm.
So being able to discuss, these are the different expectations. I'm feeling this is more like a second-year student role. What are you feeling? And she, you know, having her say, yes, I agree with you. We wouldn't want you to feel frustrated. Because you
Uh-huh.
don't want to feel too frustrated when you overextend yourself. So
Right.
being able to talk about your skill base with your field advisor and go and what your background is and from there is
Mhm.
really helpful.
Absolutely.
And it occurs to me while we're here and listening to you, just thinking of the interview you have with your prospective supervisor, ask them how they envision the supervision taking place.
Good point.
I think Gina would have explained it in a way that I would have been comfortable with. I don't remember. I think we probably talked about it, but someone might explain it in a way that you're not comfortable with.
Mhm.
You may opt not to go with that field work.
Nice.
Dina
Yeah.
could explain hers in a way that it's hectic, it doesn't really make sense in this situation to wait for one weekly session. It's better to have on-the-spot, periodic, multiple supervision sessions. And that worked out to be the case. So I think that would be another way to listen to your gut. If you have that description and you're not comfortable with it, then you might reconsider.
Yeah, I like that idea though, because my first year of the supervision, it was up to me to come with questions about the work and to kind of,
Oh.
I would come with an agenda to the meeting. And it was an hour and a half every week, sitting down and talking. And the supervision is on the spot, which I enjoyed. Both fit the placement that I was at.
Mhm.
And in saying that, you know, recognizing as an adult learner, you need to bring things to your supervision from your classwork.
Mhm.
You know, we can't just expect to be fed all the time.
Right.
We have to inquire and ask questions. And, yeah.
And we're going to be having our students do some little exercises on learning styles and read about learning styles. And I think
Nice.
that, you know, goes along with what you're saying when
Yeah.
you go out and interview to get a sense of what the field instructor's teaching style is and whether
Perfect.
it's a good fit with your learning style, because we
Mhm.
all learn differently.
That's right. That's
Yeah.
perfect.
Yeah.
That's good to hear.
Anything else that would be helpful? What about after the interview? Anything you'd recommend if you really like the agency, you think it's a good fit? Any little hints?
Follow-up note.
Follow-up note?
Yeah.
Really let it sit, think about it for a day or two, and don't rush into
Mhm.
anything.
Mhm.
Yeah, the follow-up note. And with the agencies that you do not take a placement with, you know, thank you for the time to
Yeah.
meet with them and to learn about the opportunity.
Mhm.
And maybe you'll have a chance to work with them in the future. You know, keeping your doors
Right.
open.
Yeah.
Absolutely.
Yeah, yeah,
Absolutely.
yeah.
Yeah.
But definitely a follow-up email or note. And I don't know, what would you recommend, a note or an email?
I would say either.
Okay.
I would say either, but just, you know, just some way of, I guess emails are now acceptable.
I think they
more
are now acceptable than they used to be, yeah.
So either way, but acknowledging the time that was spent interviewing you
Yes.
Right.
and thanking them for that.
Yeah.
Absolutely.
Yeah. Some contact, recognize their effort.
Absolutely.
And I do know, Bill, you mentioned time to sit with it, but sometimes when you're out there and you're fighting for internships, sometimes you don't think you
Yeah,
have
right.
the time.
Yeah.
True.
You know, like, I better
That's
accept
true.
this one.
Yeah.
Just
Yeah.
yeah,
Yeah.
yeah.
And to really spend
Yeah.
some time because, you
But
know,
it's,
no
but it is
agency
important to.
Yeah, but it's like you're saying, it's not always realistic.
Yeah.
That's true.
And I think going back to the fit, because no agency is perfect. You know,
Right.
every agency has challenges. But if you don't have a good relationship with your field instructor, it can make for a very long year.
Exactly.
So making sure that that fit with the field instructor
Yes.
is there.
Very important.
Yeah, it's very important.
Yeah.
Yeah. Anything else?
No?
Great job.
Yeah.
Thank
Thank
you.
you.
That's it.
Thank
Thank
you.
you. Thank you.